And I think Vicky is asking in which countries the project is with UN Women. Do you know which countries?
I know that they have done something in Argentina. I know that they had, I can then provide the list because they were still, I think they had selected some African countries, but I don't want to say things that then are not true, because they have had some delays with the COVID-19 for the funding. So I'm not sure where they stand. But I think that, the approach, just to come back to what you said, the ILO Director General, when there was COVID-19, has given a message to the World Bank and to the IMF, not to put in place austerity policies. Austerity policies are policies that have been put in place in the global financial crisis in 2008. And these policies have actually ruined the role of the care economy, because in most countries, just to name developed countries, in the UK, for instance, the cuts that resulted in healthcare have increased child mortality and the quality of the service of healthcare. Therefore, really, he said, don't do that again, because we don't want to make this mistake again of reducing the size of the public sector. And this is actually, I think, in a sense, was well received, because you have seen a lot of public sector measures and public policies that have taken place during the COVID-19 crisis. The question now is, most of these policies are beyond the budget capacity of many of these states, and they need to be scaled back, and we need to see how they will be managed. And this is a risk now. Then the other thing that is relevant that you mentioned for developing countries is that in many developing countries there is some fiscal space, because these countries often rely for their, for instance, for their government revenues on taxation on natural resources or on export, and they put in the reserves, so they have some reserves, most of the revenues. And they are not like France or Italy, that they have a very high debt to GDP ratio, but they have actually a very low debt to GDP ratio. They have actually more revenues than expenditure, because they are scared and they will not get maybe the revenues from the commodities or from the exporting products. So I think that this fear that they have of keeping a margin is also coming from the IMF, that is actually has much more power, because on the table with the IMF, the poor African countries, they have less power than one country who is member of the EU, like France or Italy, that still don't have a very good government finance, but they manage to find the space to invest in some care economy policies.
Yo en realidad quería hacer una pregunta. Buenos días a todas y a todos. Con referente al tema, el tema del cuidado, que tiene que ver con qué ven ustedes o qué piensan ustedes del tema de las agencias de colocación, porque mayormente, y esto está pasando en muchos lados del mundo donde nosotros tenemos leyes que dan protección a las trabajadoras domésticas sobre el tema del cuidado, y les hacen creer de que son trabajadoras de la salud, pero llegado su momento, cuando la contratan, el salario es el salario de una trabajadora doméstica, la sacan del sistema del derecho de protección, que me parece totalmente importante proteger, porque mayormente le dicen que son trabajadores independientes, trabajadores que no tienen derechos, o que son monotributistas, o los que quieren embarcar en un encuadre normativo como personal de la salud, cuando sabemos muy bien que el trabajo doméstico en muchos lugares, nuestras compañeras no tienen la terminal educativa que tienen las enfermeras o las auxiliares de enfermería, pero para poder encuadrarlas, para poder engañarlas, las agencias mayormente les dan esa versión para poder sacarla de los derechos de la seguridad social, y eso está pasando mucho en Argentina, con el tema de las agencias, con el tema de muchos proyectos de ley que tienen que ver con el cuidado, pero que realmente son trabajadoras del hogar, y muchas que nosotros como Argentina tenemos una ley totalmente protectora a la seguridad social y tienen muchísimos derechos. Entonces, ¿qué piensan ustedes con el tema, o qué perspectiva tiene la OIT con el tema de las agencias y la de protección que dan las agencias a las trabajadoras del hogar con hoy el tema del cuidado, ¿no? Porque ese es el engaño que hacen las agencias. Ustedes son cuidadoras calificadas como enfermeras o como auxiliares de enfermería, por ejemplo.
Fish, do I translate?
Yes, please.
Okay. Okay, so Carmen is asking a question about what do you think about employment agencies that are providing employment, or rather matching domestic workers with clients, but that these agencies usually make them believe that they are care workers in the sense of health workers. But the truth is that they are domestic workers. And in the case of Argentina, a little bit of context, in Argentina, they have a domestic workers law and they have ratified C189. So if a domestic worker is working as an independent, self-employed health worker, that will mean no protections under the domestic workers law, no social benefits such as social security, and leaving them out from the national care policies that they have. So I guess the hook is that domestic workers are being told that they have, let's say, like a higher, how can I say, ¿cómo se dice? Like a higher prestige because they are health workers, maybe performing the duties of a nurse. But the truth is that to be a health worker, you need a professional certification. But domestic workers are making less money, but taken out from labor protections. So what do you think about the role of these employment agencies that are misplacing domestic workers in this sense?
So yeah, the situation in Argentina is quite unique in a way. And I think it's complex because there's different layers of problems happening here. The main one, I think, is that without getting into the care and the definitions of domestic work or other care work, the main issue is that there's a misclassification of the employment status. So and this problem we see everywhere with agencies, right? When an agency is placing workers, they often categorize that worker as self-employed. And we often see this as a misclassification. They should be employees with labor rights and social security rights. But often there's this kind of disguised employment relationship. So I think that's really the main issue in terms of ensuring rights for those workers, whatever you call them. You can call them anything you want. The main issue there is that if they're going to be protected, then the argument needs to be made that they are not self-employed, that they are dependent on the agency for employment, and therefore that they should have rights as employees. Now, whether they're dependent on the agency or dependent on the household is a different question, but I think the issue of being self-employed is really the first problem. So then let's put that in the care economy situation. Now, I think when we look at care workers, this is where the problems of legal definition come up. And this is where I think it's so important for the unions in the care work, in care work, that the unions be able to build alliances and coordinate and work together. Because here you have a perfect example of like the two layers of definition that I think are important here are the legal definition and then the sort of more personal the stereotypes around what it means to be a domestic worker, or the stereotypes around what it means to be a care worker, a nurse, or something else, right? So the agencies, it sounds like the agencies are smart. They're thinking, oh, well, we know that there's a stigma to being a domestic worker. So instead, let's call it something else. And in that way, we will also avoid the law. We'll avoid the domestic work law, which in Argentina is a good law for domestic workers. And there's a strong union for domestic workers, as we know. So, you know, the agencies are finding gaps in the law, and they're using those divisions and those stereotypes to operate a business where workers are not protected. Now, the problem is that, so the law then needs to be used to close those gaps. Now, if there was a perfectly good care worker law in Argentina, I only know the domestic worker one, I don't know the other. But, you know, if care workers in that category were properly covered by the law, then maybe we would avoid this problem. In a sense, it doesn't matter if it's the domestic work law or if it's the other law. The point is that they need to be covered. So this is where the coordination between the unions is so important, because the unions that cover each of these categories they need to be able to say, all right, well, we're going to make sure that when we advocate that this category of people gets covered wherever it is that they need to be covered. So then the last point is on the stereotypes. And I think this is something that, you know, is really key. When we think about domestic work, the first thing that we think about most of the time is that domestic work is informal and it's low paid and it's not dignified work. And because of those negative stereotypes, we are seeing also divisions in the labor force, right? In the care workforce, where certain care workers who see themselves as better than that are trying to disassociate themselves from what we understand to be domestic work. So, you know, I think there are various ways that that can be addressed. Certainly the motto for domestic workers unions around the world is that, you know, you want respect and recognition and that the work is dignified work. So IDWF has already been doing that for many years, to be able to say that domestic work needs to be recognized as real work, deserving of labor protections, and, you know, recognition from society at large. You know, maybe we still have a long way to go before we get there. And so in the meantime, I think there also is probably some use in figuring out how to build bridges with the other unions to ensure that in the meantime, these precarious workers are covered. But yeah, it's a very complex situation in Argentina.
Yes, I mean, Claire, I just had a very small point regarding Argentina. I think Argentina now is still, or I don't know if it's just exit the lockdown, and the lockdown we know that had very dramatic consequences on domestic workers, because domestic workers hired by the agencies, as you said, they're often considered self-employed. So, I mean, the protection that they get when there is a period of unemployment is actually zero. So the lost earnings are not compensated by unemployment insurance, even if there is one. So I think this is very, very dramatic for the working conditions of domestic workers. I mean, the lockdown, for instance, in Italy, it led to a positive outcome, because most of domestic workers were informal and employed by the household, got registered, because to move around the country, you needed to have a certification. And the domestic workers were actually, some households, they were still employing domestic workers during the lockdown. And these people were informal, they couldn't actually move. So there was a surge in formalization domestic workers. And this, I think, is the only positive things that I can say regarding this specific historical moment and domestic workers. Because I mean, I'm not sure if in Argentina there were similar cases or in other countries, and somebody has something to share regarding that. Thanks.
So I think, so the question is basically if institutional care risks creating unemployment for domestic workers. It's interesting. There was a study in Europe, I think it's a Eurofound study. I can't remember now. It's a little bit old now, but they did a survey of across Europe looking at the preferences of households between institutional and home-based care. And it was overwhelmingly people preferred home-based care in terms of elderly care. So I think there's still a preference for that. And I think that you know, obviously the COVID crisis is probably emphasizing how home-based care is preferable because nobody wants to go into public spaces. And as we saw, the impact of COVID on elder care homes was devastating. You know, once the infection got into the building, it was a mass, you know, mass deaths basically. So I think institution care nowadays is taking on a different perspective altogether. But indeed, I think, you know, with respect to changing the narrative, yeah, I think we need to really start making the point that domestic work is care work, and COVID provides some opportunities to push in that direction and say that domestic workers are providing that care, and also that it's a sector of employment that's an important source of employment for women now that can be further formalized and invested in order to compensate for a lack of institutional care or a lack of institutional care possibilities. You know, I think there's some room there potentially. But I think all of this discussion really involves sort of domestic workers unions participating in social dialogue beyond those laws that apply just to domestic work. And I think up until now, there's been a lot of, you know, domestic workers unions have been included in social dialogue more and more, but only on laws and issues that pertain specifically to domestic work. Now, all of a sudden, if we're talking about care policies, we're talking about, you know, much bigger areas. And so if we want to think about the 5 R's, one of them is representation. Well, what would that look like for domestic workers unions? It would mean that domestic workers unions need to get a seat at the table on the negotiations around care policies. And I see Carmen has just stepped away, but I think in Argentina, I think they have been starting to participate more in other policy dialogues because of COVID partly. And I think that would be one direction in which this could go, you know, where domestic workers unions are participating more in policy dialogue on care policies.
Yeah, I think our role and also the need for us to participate in policy dialogue is important, also because domestic workers have care needs. As we heard from Emanuela, I mean, we noticed there are so many gender equality gaps, social protection gaps for domestic workers. And clearly, you know, we are expected to provide care to employers, families, but our care needs are often neglected. So I think it is important that you know, we you know, give a voice on this Also the point about institutional care. I mean, while the COVID has shifted somewhat people's preference or awareness for personal care, private home care, but also we have to remember that as citizens, as women, good public care, good public health services provided by institutions are important for us, as citizens, as women, and also for our family members, for our kids. So, so maybe good institutional care will take away our jobs, but definitely we are not afraid of that. I mean, still there is a lot of need for private home care, but I mean, as citizens, as women, we do need good, strong institutional care provided by public money.